Welcome to the Health and Wellness Show. This is Paul Hambleton. Today we're going to be talking about headaches, pain, stress, and sleep disorders. Now we're going to look at these conditions in terms of the physical, mental, and emotional causes and treatments. We're going to do this from the perspective of traditional Chinese medicine. Today we have Angela Warburton with us, who's a doctor of traditional Chinese medicine. Welcome to the show, Angela.
Thank you. Happy to be here.
Well, it's a pleasure for you to join us. I'm really looking forward to our conversation today. Now, before we begin, though, I was wondering if you could tell us a little bit about how you got started in your field.
Sure, yeah. It actually was through personal experience. I'd always had an interest in health and healing, and I studied Western nutrition and dietetics, and I have a degree in psychology, which I felt were both really essential to good health. But somewhere I just didn't seem to incorporate all the different elements together, and so it was not until I had my own sort of health condition that someone suggested that I go and see a Chinese medicine doctor. And as soon as I got on the acupuncture table and she started to describe the medicine to me and how all things are important, so mind, body, emotions, health, food, all of that, genetics, that it sort of, it's like a light bulb went off, and I went, this is what I want to do. It just made a lot of sense to me. So from there I went back to school and studied Chinese medicine.
Terrific. So you had a personal experience, and that's what drew you into it.
Mm-hmm.
Now, in your practice now, do you have a special area that you focus on in particular?
I have two main areas of expertise. One is fertility, and one is integrative cancer care. I actually worked for a number of years out west at a government-funded integrative cancer agency in Canada, and from there I got to see the power of combining different modalities like Western medicine with Chinese medicine, naturopathic, and sort of all working together, as well as this whole person-focused health, which sort of operates on this idea that all areas of a person's life are essential to their healing. So from conventional treatments, better diet, emotional health, all that. And so I got to see how this had a huge impact on people's health. So I worked for a number of years out there focusing on cancer care, and then I've integrated this philosophy with my work in fertility as well. So I see other patients for other ailments as well, but these, for the past 10 years, these have been my primary focuses.
I imagine there's quite a bit of education and training to get to the level of your expertise now. Could you tell us a bit more about that then?
Mm-hmm. Well, I have an undergrad in psychology and then my health sciences, but Chinese medicine is a 4-year program, and included in that I did an internship in China. I worked in 2 different hospitals there, and then we always have to increase our training, and I've studied with other doctors or specialists in fertility and cancer care, and I'm always taking different courses to sort of up what I know. And then I've had the past 10 years, I've worked at Inspire Health at West, and then with all my work in fertility as well over here. So it's a lot of work, a lot of time in school, but totally worth it. Love it.
It sounds like you have passion behind it, and this is your focus of learning and growing yourself and passing that on to your patients. Now, are there certain types of services that you provide in particular in your practice?
Yeah, so Chinese medicine, the main areas that it includes is acupuncture, which most people have heard of. There's an herbal medicine as well, so working with different roots and plants and things like that to help balance sort of from the inside. We do a lot of work on diet as well, so not only using food or looking at it from a nutritional standpoint, but also food as having properties. So we really customize it to the person. So very simply, if someone's too overheated, they should be avoiding foods that are really hot in property and having things that are more cooling for the balance. So we do a lot that way. I also have pull in a little bit of my background from Western nutrition, and I practice cranial psychotherapy as well. So all those I integrate depending on what's going on with the person. I'll pull from all the different areas as well.
So what are some of the most common types of problems then that patients come to see you for?
I see a variety of conditions, and patients come for all kinds of reasons. I mentioned fertility and integrative cancer care are my main areas, but it's inevitable that when people come in to see me for one thing, we end up treating a variety of other things. So in Chinese medicine, the body's seen more like an ecosystem. So instead of just compartmentalizing things, it's like every aspect of the person has an impact on the whole body. So in order to get to the root of what's going on, I have to take into account all the various symptoms, body symptoms they have, their mental, emotional patterns or states, and then treat from there. So inevitably when we get to the root of something, the root of imbalance, all these things feel better. So I kind of end up treating a little bit of everything in my practice. Someone might come in with fertility issues, but they get chronic headaches or they have digestive disorders, and when we treat to find the root imbalance, all those things start to feel better.
From your point of view then, and that of traditional Chinese medicine, what might cause a patient to have headaches or migraines?
Headaches are common. I see a lot of patients with those. There are a variety of reasons for why someone might suffer from headaches. So in doing an intake, we spend about an hour and a half the first appointment just going through someone's history. So we take into consideration not just the fact that someone gets headache, but what kind of headache someone's having. So what are the characteristics of it? So if someone's got a more of a sharp stabbing pain, or is it more of a dull achy? Where in the head is it? Is it fixed in one spot, or is it general, sort of all over headache? Are there things that make it better or worse, or triggers for it? Do they experience sort of it in a cyclical fashion, so women around their period, or certain weather-related? Is it stress, related to stress or diet? So this will help me determine the root cause of the headache. And then depending what comes up for each person, we're going to treat the headaches differently because each person is unique. So again, we're always looking for that root cause. So two people, might come in and say they suffer from headaches all the time, but the root imbalance is very different. So, sometimes it can be too much stress in someone's life or a buildup of toxins in their body. Some people are really depleted and run down, so they're exhausted. So it's really about identifying that, helping people to identify what the triggers are, and then tailoring the treatment that way to help heal. So there's not one answer. That's kind of the frustrating thing.
Yep.
But there are many reasons for it, and there are many ways to approach it. Usually we look at all the different lifestyle things with people and help to treat it that way in addition to the acupuncture or herbs.
So you mentioned stress briefly. What role do you think stress might play in headaches or other health challenges patients have?
Stress has a huge impact on our health, not only our bodies but also our mental, emotional state as well. Basically, when we're stressed, our body goes into survival mode, and we're in this state, we aren't really healing or recovering from our daily activities, we're simply surviving. So unfortunately, many people sort of exist in this stress state for a great part of their life. They're not really recovering. So when we're stressed, our bodies stiffen up or tighten, and we'll restrict blood flow to certain areas just to conserve energy. So, you think of having tight shoulders or that kind of things. When we stress, we just get a little more tight. And it's literally our body trying to say, okay, we've got to survive, so I don't need to digest so much right now, but I need to maybe run or think, so our lungs will get more blood flow, our muscles, but our digestive system, not so much. And so, basically, stress over a prolonged period will throw the body out of balance, and if it's experienced repeatedly over long periods of time, we're not able to recover. So this can really deplete someone. This can cause someone to be burned out, sort of adrenal burnout. That's sort of, a lot of people suffer from that, and it just can deplete someone. So the degree of stress, like a certain degree of stress, is normal and healthy in life. It's just when it's not counterbalanced with a downtime and time to relax that things get out of balance. So in TCM, we also see stress as having a major impact on the circulation system in the body. We often relate it to the liver system, and this can really show up in headaches, especially like the tension headaches. It will show up with sort of the back of the head and the neck. It can show up with like period problems for women, or digestive complaints like IBS, or sleep disorders, just to name a few things. So it has a huge, huge impact.
That's terrific. Now continuing on with that theme about stress, what role do you think stress or pain might have in sleep disorders?
So, like we said, stress has a huge impact on the body, and when, like, just with that tightness, with the restriction of blood flow in the body, you might see, like with the tighter muscles, it will often show up in increased pain in the body, or which can show up in the quality of sleep. So someone might, if they're having sleep issues that are stress-related, they might wake up early in the morning and have trouble falling back to sleep. They might have more of a stress sleep where they're clenching their jaw, or they might be having restless dreams where they feel like they've dreamt all night and they wake up exhausted. They might have a hard time falling back to sleep, all that kind of stuff. So it's a huge impact on sleep. There are a few different reasons for sleep disorders, but the more the stressed ones would show up like that.
So that would include snoring or sleep apnea or insomnia, those types of issues, you think?
Well, the type of insomnia, so there's lots of different patterns for sleep disorders. It would be the type, people might fall asleep, but they might feel really tight. They might wake up with a headache. They might wake up with their jaw being tight, or they might wake up a couple of hours before their alarms to go off, and they just can't get back to sleep. It's like they get up before the the crows get up, or the or the calls of just they're up early and they're not able to fall back asleep, and it's just not a restful sleep often when the stress sleep. If someone's having trouble falling asleep, this could show up a little bit with stress as well. If someone's having other sleep disorders, it could be another pattern in there.
So moving on, this is getting into an area that I'm quite interested in, which is how can mental or emotional factors contribute to health conditions we've been talking about? And this would include, headaches or migraines, the stress you just talked about, or the pain or the sleep disorders. What role do you think those have?
Yeah, well, mental emotional health is huge. I sort of mentioned before, the body, we look at it like an ecosystem. So that means everything from what we eat to our lifestyle to our genetics to our thoughts or beliefs or mental emotional states. It all has a huge impact on our health. So in Chinese medicine, we break things down into patterns. We work to identify the underlying pattern of why someone's sick or off balance. And we often talk about organ systems in Chinese medicine like we know in Western medicine, so the heart, the liver, the lungs. But in addition to sort of the anatomical functions, as we know it from a conventional perspective, we also look at emotional states or mood as affecting one system more than the other. So I'll just give you an example. This is actually what prompted me to get into Chinese medicine, my own health issue. I had been training for a marathon and running for over 2 hours at a time when someone died very suddenly. And I went to go for a run a few days later, and I couldn't breathe. I couldn't even run down the block without having this asthma. So I went to my family doctor who prescribed an inhaler, and she diagnosed me with exercise-induced asthma. So I was kind of frustrated because I wanted to know why I went from running 2 hours at a time to not being able to run down the block overnight, basically. So that's when I went to see this Chinese medicine doctor, and she explained that in Chinese medicine, the lung system often gets affected by grief, and particularly grief or sadness that comes as a shock. So by working with acupuncture and herbs for a short time and then processing my grief around this person who died, my lungs healed, and it hasn't come back. So it's sometimes realizing that emotionally what happens to us will have an impact physically as well. So they can't be separated in that way. So for me that was a wake-up because I knew there must be something related, but from a Western standpoint, which has its benefits for sure, but I was just frustrated when I want to know what happened so I can work to heal on it. And it was such a shocking sadness that sort of happened. So as far as headache, stress, pain, sleep disorders, sometimes our long-term mental or emotional states will start to wear down our systems and throw our bodies off of balance. So if we can identify our emotional states and seek to find ways to help acknowledge or balance or heal these mental states, our overall physical health can improve as well.
So you mentioned, this trauma that you went through, but also it could be long-term. So with patients with various conditions, the emotional and mental factors could be something that comes on acutely, such as you experienced with the death of someone that you knew, but also it could be something that's been building up over the case of years?
Absolutely. Like with mine, it was a shocking death that happened. There was no there's no lead up. It came out of the blue, so my system kind of went into shock. Where other people, they might have, just slowly a little bit too much stress or a little too much anger building up, or worry, just pensiveness over too long, and just slowly they will start, like with pensiveness or worry, the fretting, it often affects the digestive system. So people who are maybe worrying, or thinking, they might have bloating after they eat, they might have looser bowels, that kind of stuff that just seems to either be triggered when they have something they're really worrying about, or just long term, it just slowly gets a little bit worse over time. So you can see it both ways, absolutely.
Terrific. Now, moving on about your treatment approaches. So if somebody came to you with headaches, how would you treat a patient with headaches? What would you do?
So I'd really look to find out more about the type of headaches that they're getting. That's really going to help me diagnose. So there are headaches which we classify as an excess type headache. So basically means there's too much of something in the body and we need to clear some of it out to balance it out. So this might show up in a throbbing or stabbing headache, something's triggered by huge stress or emotions, or like eating too much rich greasy food or something like that. And then other headaches that might be a result of being depleted, which might mean someone just overextends themselves and gets really exhausted and runs down or loses sleep over a long period of time. So this might show up as more of a dull, aching headache, feels better when they lie down, when they rest. It really comes if they've had too many like working too many hours in a row or something like that. And then others might be triggered by weather, so damp days, cold days, and all that kind of, all those kind of things can play in as well. So I'd work with the person to find out what the triggers are, and then identify the root of it. So is it through, is diet throwing them off? Is it just that they've been depleted for too long? Or, and then working on things like diet, so removing some of the triggers or adding foods that might help to replenish them. Work on acupuncture to help actually, sometimes we say there's a blockage, like if something's like a stabbing pain fixed in one area, we want to sort of break up that blockage. So that's where acupuncture or something like that would come in, and it's quite effective. People come in with headaches all the time and leave with none. And it's just a matter of putting some acupuncture needles in.
So the treatment, the results could be quick, or maybe a series of treatments depending on the person's particular individual situation. That's what comes about from your initial diagnostics.
Yeah, and it really depends on how long someone's had something for. So if something's been around for a long time, it often takes some time for it to go. If something's acute and came on suddenly, sometimes it can go faster. If they don't get headaches and they just happen to have one that day, it can go and not come back. If someone gets recurrent headaches, and so we're going to look at why do they keep getting them. So I can treat them in the moment, but I also want to look to treat them long term, so to remove whatever the triggers are going to be, whether it be giving them homework to do at home or by doing things in the office or with herbs to help as well.
So what about stress then? How would you treat a patient with stress?
So, I mean, a big part is identifying the main stressors in someone's life. So it can be anything from a stressful job or relationship to an overly busy life with too many demands and not enough downtime, or a diet that's putting undue stress on someone's organ systems through, and it might have show up in the buildup of toxins or inefficient digestion or malabsorption of nutrients. So I'd identify some of the underlying issues, and then I'd work with acupuncture herbs, looking at dietary stuff, lifestyle changes to help regulate and rebalance someone to reduce some of the effects of stress on their body, and then, but as much as I can do as a practitioner, part of my role definitely is to help guide them to be doing the things at home, like to make the changes that are essential to helping them sort of rebalance. So I often say it's not. Sometimes it's big things that make a difference, but often it's these little things that we do over time make the hugest difference in our health. So we can't expect to do the same things over and over again and have our body respond in a different way. If we want to see change, we have to make changes. People often think those changes need to be painful or unpleasant, but really it's not. Often it can feel really good and people feel better, and when they can identify things that are maybe either a food or some sort of situation where they can just make a subtle change, it pays off big time, and just the way that they feel, and it can make the biggest difference to their health.
So partly it looks like it's a partnership. I mean, there's certain treatments you provide yourself, but then education to the patient as well as ongoing support to help to identify what they need to make the changes in their life, whether or not it's subtle or a little bit more major, but then helping to keep them on track. So it seems like it's a partnership between yourself and the patient in a lot of cases.
Absolutely. It's really, that's the hugest thing. If I'm doing my job well, there's a saying in Chinese medicine that the best doctors have no patients, because they've educated their patients to know how to take care of their health at home or to recognize when they're off balance and know what to do to rectify that. So really my job to me is to teach the person about why I'm doing what I'm doing, to give them options so they know what's going to work for them, that's going to serve them better, and then they're more empowered to make those choices. And if something comes up, they can come and see me, but really it's I'm not with them 24 hours a day, they're with themselves. So it's really it's a team, definitely teamwork.
What about sleep disorders then? How would you treat that?
So again, it has many different roots, like anything. 10 people can come in with the same complaint, sleep disorders or digestion, but their root's going to be different. So when someone comes in with a sleep issue, I need to find out what kind of sleep issue it is. So is it having a hard time falling asleep? It will be treated very differently than someone who wakes up through the night repeatedly or falls well but wakes at 3 a.m. and can't fall back for hours, or someone who wakes at 5 a.m. or someone who wakes up with night sweats and that sort of thing. So, some sleep patterns are a result of too much stress, like we talked about. Others are due to the body being depleted and it needs to be replenished. This is often the case with like perimenopausal or menopausal women. It's often important to note that often sleep issues will be common among certain things like aging women in North America, but they're not normal, which means women don't have to have it. So I think that it's important for people to know that they don't have to live through something. This is part of getting older and stuff. There's always something that you can do. So I think that's with any of these conditions, we want to look at the whole person, the mental, emotional, physical, how someone lives and works and eats, as well as their family history, and to see what's off balance and why, and then treat from there. So that's the same with the the sleep disorders. It's like a very holistic and complex system, Chinese medicine, but really logical, and it's a very complete system of healing as well. So it's often like I said, these simplest things that people can do to make the biggest difference to their health in the long run.
So I imagine a lot of patients come to you because they have an acute problem, such as headaches or stress or sleep disorders, and they want to get those issues resolved. But I guess, in a lot of cases, those patients, as well as yourself, on behalf of your patients, you want to see them graduate more towards overall wellness. So how can your approach in traditional Chinese medicine help, lead towards that with patients?
Yeah, I mean, that's the very foundation of TCM is about seeking to find the root imbalances of a condition and bring balance back to the body. And we don't, there's sort of simple balance, like you're just on a tightrope and you could fall off, and then there's harmonious balance, which we kind of think of basically thriving, like feeling really excellent in your body and having the energy to do what you want to do, and your sleep is good and your digestion. So that's really like that overall wellness is always sort of the focus. And it's not just band-aiding the symptom and making it go away, whatever someone's coming in from, but more strengthening the whole body, so that basically when we look for that root cause of what's going on, people will come in with one condition, and I'm going to ask them about all these other things. And it's sort of like puzzle pieces, like piecing it all together. Usually the underlying root cause is the same for all of them. So if we treat that, not only what they come in for is getting better, but all these other little signs and symptoms get better as well. So that's the kind of the beauty of it. When we're whatever we're treating, we're working on overall wellness as well.
So if somebody wanted to know more, understand more about any one or a combination of these conditions, headaches or migraines, pain, sleeping disorders, stress, wellness, what would a couple of tips be that you'd have for people?
I think one of the biggest things is to get curious about their condition. So really notice, like nobody knows their body as well as they do. No one knows your body as well as you do, or me as well as I do. So get curious about it. Like notice what's been going on in their life when things come on. What have they eaten over the previous few days? What's going on in their life? Are they busier? Have they had more stress? Does it get triggered at certain weather? Like has it been raining, or it's about to rain? Have they just had a fight with someone? Are they anticipating the fight with someone? Something like that. All these little bits of information can give people more insight into their body and the imbalances and what's triggering it, and then what they can do to change. So that's sort of empowering when you understand the sort of what's contributing. Also note things that make it feel better. Do things feel better when someone's on vacation, when they're when they're lying down, when they don't have a glass of wine, or they have one coffee but not 3 coffees. Is it better in heat or dry weather or worse? All those kinds of things. So just getting curious can really help. It sort of empowers the person. It's supposed to something happening to them, realizing, oh, wait a second, these little things that I'm doing are actually contributing to feeling good or not feeling so well.
So when they've identified that, then you're through your education probably helping them to identify what some of those triggers will be, and then they can run it by you on an ongoing basis to sort of refine what's going on in their life that helps them to make them feel better, and what's leading them in the wrong direction, and hopefully course correct over time.
Absolutely. Like I had a patient who was going about, just had a sleep disorder, and we've been working, and she'd been doing really well, and then came in and she said, I don't know why I'm not sleeping again. And so I said, anything changed? And she's like, no, everything's the same. And then she goes, oh, I just did this half marathon. And I said, oh, so you've been running more? And she said, yeah. And I'm like, have you been resting more? She's like, nope. And I'm like, okay, it's like too much energy going out. So if we make changes like that, doesn't mean don't do the marathon, but just account for that and make other changes in life so your body has a chance to recover. And so she's like, oh, didn't even think about that. Didn't even register. And so, and just working together, it's again that teamwork and sort of saying, okay, so just paying attention to those little things, because we're always navigating life. Seasons change, energy level change, all that changes in life. And so if we can just be mindful that we're not supposed to be, I always joke, people always have this level of energy that's their bar. So it's usually when they're the most rested, it's the summer, they've had a great time, they're productive, and that's what they think they're always supposed to be like, and they always are striving for that. But sometimes it's just like animals go into hibernation in winter. We're supposed to rest a little more. If we're expending a lot in one way, we need to balance that when we can by vacation or resting or sleeping in one day or something like that. And all those little things, make a huge difference.
I have a friend who's like that. He hibernates in the winter and he comes alive in the summer, and it's
great. It's wise. Very wise. Back to nature, back to basics.
So now if someone was looking to find out more about traditional Chinese medicine, they were looking to visit a practitioner, who provided these types of treatments, what should they know or look for?
Well, first and foremost, it's a relationship. So just like any relationship, you want to make sure that you feel safe and comfortable with whomever you go to. So not every practitioner is for everyone. So I always suggest, people can have a brief phone chat with someone, or talking to the practitioner before they go, or ask for a referral from someone who's been that they trust as well. Many provinces are also regulated for TCM, so you want to make sure that they're licensed, which basically means they've had a certain amount of classroom hours and clinical hours logged. And then obviously if you're looking for treatment for something specific, try to find someone who specializes in that. There are lots of great practitioners. Sometimes if I don't feel like I have an area of expertise in something, I will refer to someone else who I think is great. So sometimes, asking the practitioners themselves who they think would be a good fit. But I think really, what's really important is that relationship, so that people feel that they're being heard, that the person listens, that they feel comfortable with them, because it is a very intimate relationship and people end up sharing a lot of emotional things, or you just want to feel safe when you're there, definitely.
Angela, I'd like to thank you very much for being on the show, both in terms of your time as well as your expertise and wisdom and knowledge that you've shared with us graciously today. Thank you very much.
No, it's my pleasure. Thank you.
Now, if listeners want to get in touch with you, what's the best way that they can do that?
Well, I have a few websites. I have my personal website, which is angelawarburton.com, or my clinic website, which is, the clinic name is Urban Wellness, so it's urban-wellness.ca. They can look for information, either phone number or email contact there.
Okay, great. Now, could you spell your name for angelawarburton.com?
Absolutely. Yep, it's Angela, Angela, Warburton, WARBURTON.com, and it's all together. There's no dots or anything.
Okay, but with Urban Wellness, there is a hyphen.
There is a hyphen. It's urban-wellness.ca.
Okay, fantastic. Once again, thank you very much for being on the show today.
My pleasure. Thank you.
Thank you. Bye-bye.